Hi, I'm Molly, and I'm going to talk to you about the movie I chose, and that was The Doctor. The Doctor was created in 1991. It stars William Hurt. He plays the lead role as Dr. Jack McKee. And throughout the video, you will see a bunch of legal and ethical issues, a bunch of HIPAA violations. There's some insurance issues because depending on what type of insurance the patient has, determines the tests that can be performed on the patient. The movie shows Dr. McKee as acting as both doctor and then as patient. It follows him. Dr. McKee has this agitated cough, and his wife makes him go to the doctor, and it ends up being a growth that gets biopsied, and they find out that it's malignant. He goes through radiation and then eventually surgery to have the tumor taken out. Like I said, throughout the video you see him as the doctor and then as the patient, and Dr. McKee does not have good bedside manners. In fact, in the beginning of the movie, you see him performing a surgery on a patient that jumped from a 5-story building. There's a lot of joking and singing going on in the OR, and he even makes the statement there should be a course on suicidal techniques, and that next time the patient should jump from a minimum of 10 floors. He doesn't really talk to the patient while the patient's unconscious. He believes that if they're unconscious, then you don't have to talk to them. However, the other surgeon, Dr. Bloomfield, who specializes in throats, he talks to his patients while they're under sedation. He tells them step by step what he is doing and who's coming into the OR. Dr. McKee and his practice partner, Dr. Kaplan, both poke fun at Dr. Bloomfield. There's other poor bedside habits that Dr. McKee has. He is shown going into a patient's room, and this patient is a woman, and she had a cabbage done by Dr. McKee, and he's looking at her staples. He walks into the room and doesn't say much, just takes off her gown. And you can tell that she's very modest, very shy, and very uncomfortable, especially after he takes off her gown, because, I mean, she's just sitting there pretty much naked. And then she asks him a very personal question. She said, that she's worried that her husband isn't going to be attracted to her because of the staples. And he looks at her and says, "You tell your husband that you're a Playboy centerfold, and you have the staples to prove it." This makes her extremely uncomfortable, and you can tell, and that's just poor bedside manners on his part. You also see poor bedside manners whenever he is taking his med students around. He doesn't address the patients by their name. He just addresses them by their room number or their diagnosis. And one med student brings up the topic about how doctors should be caring. And Dr. McKee puts her in her place and tells her, surgeons aren't caring. They don't get involved in their patients' care. They basically get in and get out. And he made a statement about how I'd rather cut than care. But like I said in the beginning, his persona, you watch as his persona changes. His bedside manners change throughout the movie because he ends up becoming a patient, and he gets treated the same exact way that he treated his patients. They don't tell, the doctors don't tell him what they're doing before they do it. His one doctor, Dr. Abbott, who found the growth, she sticks a tube down his throat without him knowing, gives him an anesthetic without telling him. In one scene, he is getting a biopsy done to see if the tumor is malignant, and while he's in the hospital, he had the biopsy done, he can't talk. A nurse comes in and ends up giving him an enema that is for the patient in the other bed. And you can see that Dr. McKee is like, no, that's not me. He can't talk, but he's like pointing to the other bed, and he's swatting at the nurse and trying to get away, but he ends up getting the enema instead. And the nurse didn't check an ID bracelet, didn't ask Dr. McKee what his name was, and that just reinforces that, you need to go through patient, like, you need to check right patient, right med, and Dr. Abbott finds out, and she comes in and she's pretty much like, sorry about your luck, you had the enema. They don't take responsibility for their mess up. She also is very cold, and she tells Dr. McKee at that same time, after she's pretty much like, sorry about your luck, you had an enema, can't do nothing about it. She tells him that the tumor is cancerous and that they're going to do radiation on him. Even though he would like it to be cut out, she wants him to have radiation. She doesn't want to cut the tumor out. He ends up getting radiation. You see him go through the process of finding out if he can accept the treatment. They put a plastic, they're testing him, and they actually give him a tattoo without him even knowing that it was coming. They give him a tattoo right here to mark the spot where the radiation is supposed to go. And they also get a mold of his face, and they put a plastic, like, saran wrap over his face that has a hole cut out so he could breathe. But still, that would freak anybody out if you didn't tell them what you were doing. During his treatment, he meets a woman, June, who has a stage 3 brain cancer that was found after 3 months. And it was all because of her insurance. If she had better insurance, she would have gotten an MRI instead of all these CAT scans. The MRI would have showed the tumor quicker than the CAT scans. But she pretty much puts Dr. McKee in his place by telling him, because he acts like where he works there and he's a doctor, that he should get top priority and the best treatment and care there. And she puts him in his place and is like, you know, you're just a patient, just like the rest of us. You're not anything special. Your title doesn't mean anything while you're a patient. But like I said, he changes his bedside manners and everything throughout the movie, and towards the end you see him showing more compassion, and he even takes his med students and gowns them up in patient gowns, and tells them that they're going to be patients in the hospital for 72 hours because he wants them to realize what patients go through, being vulnerable. I mean, any one of us can be a patient, and I would want to be treated how I treat my patients. And, you know, patients are feeling vulnerable whenever they're sick, and they're scared. They depend on us as medical staff to help them and be there for them. It's just a really good movie, and it makes you think, like, how can I better my patient care? Like, you know, like I said, we're all going to be patients someday. I would like to be treated with the same compassion and caringness that I show my patients. It's a really great movie, and I hope I didn't spoil it for anyone. There's some HIPAA violations that were shown throughout the movie, and that too makes you think, you know, you need to be careful while you're walking in the hallways. You don't want to talk about another patient's care, because who knows who can hear, you know? But I recommend this movie to everyone. I think that it gives you a good perspective on how you should treat patients and how you would want to be treated as a patient. Thank you.